Welcome. You're listening to the Keeping Ashland Healthy podcast, a podcast production of the Mental Health and Recovery Board of Ashland County, Ohio. Thanks for joining us. And welcome back to another episode of the Dr. Ashley and the Boss podcast here on Keeping Ashland Healthy, a production of the Mental Health and Recovery Board. Welcome.
Thanks. How are you this morning, boss?
Well, yeah, I'm nervous. We've got a couple guests, and
I know. So intimidating.
Very intimidating people in the room with us today for overdose awareness. We're doing some awareness raising of this important issue, and we brought in heavy hitters.
Yes, we did. I'm really excited about this one.
I am too. Well, in the room, Mr. Ford, welcome. Nice to see you here. He is the director. Can you say welcome? I'm glad to be here.
You're forcing me?
Yes, yes.
Yes, welcome. I'm Rick Ford. I'm the director of ACCADA.
Yes. The ACCADA director, and again, we'll mention these numbers as we go out, and I'll put them in the episode description, but ACCADA is 419-289-7675, but again, I'll mention that again later. Mr. Ford, the director, is also a licensed independent social worker, years of experience in substance use field, so his insights and I think expertise in this topic will become apparent as we go through the episode. Also joining us is our health commissioner in Ashland County, Vicki Taylor. Welcome, Vicki.
Thank you for having me today.
Well, I appreciate you being much more easy to work with than Mr. Ford. So, Vicki is over at your new location. I still consider it a new location on Claremont there, and their number is 419-282-4231. Again, information again later in the episode and in the episode description. But Vicki is our health commissioner, and Rick have got a real, I think, important and unique view of overdose awareness, and we're interested in talking that through in its aspects because, again, it's a serious issue that Ashland County is trying to do multiple approaches, Dr. Ashley, to see if we can't bring these deaths down to zero, which is always our goal.
Yeah, we're losing too many people to overdose, absolutely.
Yep.
So this is an important topic today.
And that kind of feeds into my first question for anybody, really, is, why, particularly in Ohio, but this is an effort that's going on throughout the country, why Overdose Awareness Day? And then as we're doing here in the county, this is an all-year kind of focus, but we're using the day, if you will, as a springboard to talk about this issue. But why is it so important?
Well, the first thing, opioids kill more than 136 Americans every single day.
Yeah.
Think about that. That's a lot of people every day we're losing.
Right.
In 2022, 4,915 lives were lost from unintentional drug overdoses.
And that was in Ohio, I think.
In Ohio.
Yeah.
81% of those involved opioids.
Yeah. So again, for our listeners, we've talked about fentanyl, and fentanyl is one of those opioids that is typically involved. Is that right, Mr. Ford?
Yes.
From your experience, both in terms of the treatment as well as prevention, and some of these stats, it seems like so many of the opioids that we talk about, fentanyl is the one that seems to be the one that's causing so many of these overdose deaths.
Yeah, that's absolutely correct. And fentanyl, it's an illicit synthetic opioid. So, even the majority of those overdose-related deaths in Ohio and across the country, most of those involve fentanyl specifically as the type of opioid that was. It's very pervasive, it's potent, and it's profitable.
Yeah.
And that's why it's in the drugs, in the illicit drugs. Obviously, in the hospital setting, quite different.
Sure.
Fentanyl is used for medical purposes and it's safe, but not for illicit drugs. And it's in every type of drug nowadays, not just, the standard opiate or heroin, street heroin. We don't, unfortunately, hear much about heroin anymore the past few years, and that's because of the synthetic fentanyl really being so pervasive in all types of drugs, especially stimulant drugs such as amphetamine, methamphetamine, cocaine. It's pervasive. So for the person that's really a drug user, it's almost the norm or the expectation that fentanyl is going to be a part of it.
Interesting. Well, Dr. Ashley, Vicki mentioned some of the national statistics and then some of the Ohio statistics. Can you tell us a little bit about, again, why we're focused on it in Ashland County? Do we see some of these numbers reflected in Ashland County data?
We sure do. And the sad part is that as we talk about fentanyl and it being mixed in with other substances, no one ever knows how much they're getting.
Yeah.
And that dosage is scary and how deadly it is. Fentanyl was the leading drug use in our overdose deaths in the last few years.
Okay.
But I also wanted to kind of raise the fact that demographically, drug overdose is affecting every demographic in our community. So it's not like you can pinpoint one certain age group or one certain race or population. It is pervasive everywhere.
Okay.
And that's just the impact of the deaths of the people using the overdose.
Yeah.
Doesn't even talk about the impact that it has on the families and those that are left behind. So
Right.
it's a serious issue, and it's one that's concerning, and it's concerning enough that in the last few years, the Ohio Department of Health has encouraged all counties within the state to start doing an overdose fatality review.
Yes.
So that we can get to understand what is happening in our communities and to provide the data and work together as a community to kind of come up with ideas on how we can curb this from happening in our community.
Yeah, I'm glad you mentioned that. Mr. Ford, Dr. Ashley, and myself were all with you, as well as
Yes.
other key partners at that last meeting, and appreciate your leadership in that. But if I recall, when we were actually trying to figure out the actual number of overdose deaths, and I guess that would have been calendar year 23, I think that might have been amongst our highest numbers that we experienced. So this issue is front and center, I think, in Ashland County.
Yes, and 2022 we had maybe 2 more overdose
Okay.
deaths than 2023, but the trend is clearly going up
Okay.
from where we were when we first started looking into this. So it is concerning. The average age group is in the mid-30s.
Okay.
So if that's the average age group, you can see what's happening there. But we also had some juvenile overdoses, and that was really concerning as well.
Yeah, that gets it. I think what Mr. Ford was saying about it being in so many other substances, whether you think you might be taking, I don't know, you name it.
Something like what they refer to as like a study drug or a stimulant, so something in like the Adderall. Oftentimes it's in a benzodiazepine, so Xanax, Klonopin, those classifications of medications that you think you're getting one thing, but you're not.
Right. So one of the things we talk about, I know your prevention specialists try to make this point with the young people is, if the medication's not prescribed to you, don't take it. Because if you're taking it from somebody else, even if they are a quote unquote friend of yours, if you don't know where it's coming from, it might even say, to your example, Rick, it might even say Adderall or something else on the pill itself. It might be stamped correctly, but they're making these counterfeit pills look very close to the original. So again, safety first. If the drug or the medication is not prescribed to you, don't take it, even if it's somebody you know really well.
Yeah, something I've heard you say before, experimentation is not the same today as it used to be. The risk is much, much higher because of the fentanyl and just the potency of that drug.
Yeah, agreed. Again, we're speaking with Vicki Taylor, Ashland County's Health Commissioner, as well as Director Rick Ford of ACCADA. So we've talked a little bit about the whys and why the attention, and it's the numbers. We're losing far too many people, Ashland County, in the state, in the country. So one of the things we wanted to highlight for our listeners is, what we're doing locally to address this issue. Because, Vicki, you mentioned the Overdose Fatality Review Committee. Now, that's not something a lot of people would see in this community. It's an important thing that we all are doing, and I think some action steps can come out of it. But there might be some more tangible or easily identifiable things that both of your organizations are doing. So I wanted to talk through those if we could. So one of the issues, one of the primary overdose reversal medications is Narcan. So either one of you, can we talk a little bit about what Narcan is, how it works, and where folks can get that?
Well, Narcan is really the first. There's quite a few. There's a few others out there now as well.
Mm-hmm.
But, Narcan being, is the drug or medication to utilize in a crisis if we suspect that someone is an overdose. It's an overdose reversal drug. So basically, not to get too scientific, but it bounces some of the opiates off our opiate receptors in our brain. And then essentially, hopefully, bring someone back in their central nervous system and the breathing back. That's the simplest way I can explain it. I'm not a science or a doctor, so I won't try to pretend to be one. But at the same token, it's probably the most accessible and easiest harm reduction, life-saving intervention that anybody in our community, our state, our country can do. Narcan's available, not only at ACCADA, but us obviously through the health department. And we provide, we're available to provide Narcan education, what it is, how to use it, and really what to do in an overdose situation on a daily basis.
Yeah. Any issues, Vicki, that folks need to be concerned with in terms of, I've heard this before, what if I give them Narcan and it wasn't an opioid that they're overdosing on? How concerned do we need to be that, I give them the Narcan and it wasn't an opioid? Will that hurt them in some way?
So my understanding it is will not hurt them.
Okay.
So it's better to try the Narcan and because chances are it's going to be opioid related.
Right.
But if it's not, it won't do any harm.
Yep.
And so we're trying to encourage everybody to carry Narcan. It's free. It's easy to use.
Right.
And we can give you a 2-minute demo on how to use it.
And I think both your organizations would do that if folks want a
Absolutely.
demo, before they distribute that. And it could be that quick because it's really a nasal.
Yes.
Neither one of you guys are distributing any of the injections. I know that's another route, but I think with needles, people get very, very nervous. So
Absolutely.
we wanted to take that out of the equation. So the nasal distribution is like a one plunge and it's one and done. Yep, and it's as simple as that to use. So we're hoping that takes away some of maybe the barriers that people have in mind.
If they do walk into ACCADA, the only thing we really need to know is their zip code. We don't need to know their name, any personal identifying information other than really a zip code. In fact, even we had a call or an email over the weekend that I responded to, and the gentleman came in this morning and met with our peer recovery support person to get that Narcan, a few kits, and then also the education that goes with it. And they were just providing general education around recovery and what that may look like. He was coming in for his significant other who's going to be coming home soon. So he wanted to make sure, just in case there was a potential for relapse, that he was educated and armed with the drug overdose reversal drug. So,
That's great.
That happens.
Yep. And again, Rick, I'm going to take occasion since Rick brought this up. When the recovery journey for a lot of folks that are struggling, whether it's opioids or any substance, but particularly with opioids, what we've seen is a real risk if the person maybe has been in recovery for a period of time, hasn't been using for a period of time, but then has a slip or a relapse. Oftentimes, they'll go back to using in a way, in a manner, at a level that they're used to, but their bodies have changed in the intervening period of time. So they are really high risk. I mean, it's always a high risk, but if you've been clean and sober for a period of time and in a period of abstinence, and then you go back to using, that person's really at high risk. That's fair to say, Director Ford, that, so having the Narcan on available in those situations seems to be very wise. But I just want our listeners to know that. So if you're supporting a loved one that maybe is doing well, they've got a period of sobriety and abstinence under their belt, but they're back. Maybe they were in more of a controlled setting, whether that's a rehabilitation or residential, and sometimes even in a jail. Once they're out, there's a high risk there. So you want to be involved with your loved one's life and have Narcan available.
Right. Absolutely. You said it perfectly.
Well, thank you, because Dr. Ashley never, comments that way. So I appreciate you, Mr. Ford.
Yeah, you said it perfectly.
That was great.
That's exactly right in terms of the risk. And, I think that's exactly why one of the interventions that we help with the county is being available in our jail programming and folks getting released. And then we have the MAT, which would, medication-assisted treatment, but also just the awareness of having Narcan and that they are going to be released and that they're at high risk if they were to go reuse, just because of what you had said earlier.
So you're already doing that education with the individual as well as maybe those people they're going to be around. That's great. That's great. Another thing we're doing locally is these I've got one in my vehicle actually right now, is a naloxbox. I've been taking these around. I know Rick at ACCADA has been distributing these to organizations and businesses that want one, and I know we can still do that if you contact Mr. Ford. But what is a naloxbox? That sounds interesting.
Well, essentially they are an emergency kit holder. But it also will have like facial coverings in there. The naloxone itself or the Narcan is equipped in there. So a few kits of those, and then just remembering to replenish them if they are utilized too. So it's just not a box holding the Narcan itself. But it also gives instructions on how to administer the Narcan, what to do in crisis. So it lays it all out. There's information sheets that anybody could pull off and use to give real good directions about the signs of overdose, how to administer the Narcan, what to do, in that whole crisis situation, and hopefully there is enough Narcan that it helps bring someone back.
So Vicki, you had mentioned this, but the idea is to have these boxes in publicly available, publicly accessible locations, so that anybody could possibly intervene. And again, no cost to get a box, no cost for the Narcan in either one of your organizations as well. So I want to make sure that's, so price is not an issue. As you heard Vicki and Rick say, they can do the training in as little as a couple minutes on how to use the Narcan. But the naloxbox is really just intended, as Rick said, to be just a container. And like I said, it's a pretty heavy-duty container that can be placed on a wall, have the information, as Mr. Ford said, available. And we're trying to increase how many of these boxes are throughout Ashland County. Because, again, you said it when you were talking about the demos, Vicki, it doesn't discriminate. So our thinking is they need to be all over town, because we never know when somebody might experience an overdose, and that box might save that life.
Right, and we talk about these overdoses as being unintentional, because they are. But there's also people that weren't even wanting to use drugs and had exposure to it.
Okay.
And we also need to be able to have Narcan available for that. And we found that happened at the Sheriff's Department. But that can happen in a school setting or anything.
Sure. Unintentional exposure.
Right. Unintentional exposure, either through someone else having it available in a home or something.
Sure.
So I think we want to get rid of that stigma that we're only putting it out there for drug users, which we are, because we want them to be able to recuperate and recover and have access to care. But it's also, children could get into it somehow.
Sure.
And you would need to be able to act quickly and get the Narcan available to them.
Now,
I would love to see it in school systems and every business and all of our public places.
So now, Vicki, I know Mr. Ford at ACCADA, they're a distributor of the boxes. Do you also have those available?
We have some that we can get also through grant funding.
Okay.
Available. So
again,
and we also put it in so we have AED boxes all over,
sure,
right? Yeah. We even put doses of Narcan in our AED boxes.
Okay.
So even if you don't want a whole naloxone box, but you have AED boxes in your facilities, we could give you doses of Narcan to put just right in that box, so it's right where it's available.
Okay. Well, that's important information. And again, I'll have those numbers available. for both Vicki and Mr. Ford in the episode description. So if you're interested either in the Narcan or in the naloxbox, you can contact them on that, because that's an important ongoing effort. And that's a part of education and prevention, which I wanted to talk about just briefly, because we had some of the prevention specialists from ACCADA on a few episodes ago. But I just wanted our listening audience to know that this is part of the curriculum that they added a few years ago. The prevention specialists in Ashland County in our school system, they've been talking about some of the harms of other types of substances for some years, whether that was marijuana or cigarettes or alcohol. But they've added, some sections on opioids because of, the crisis that we're in. So just wanted, we don't have to spend a lot of time. I would encourage folks to listen to that episode. But that is going on in our school systems as well as in our adult realms, which is what we're talking about now. We're also doing education and prevention for our adults, and that includes things like our drug drop boxes. And we've got two of these. They look like almost like if you're mailing, going to the mailbox, the old school mailbox, Mr. Ford, the old blue ones, the standalone. Right. Well, they look like that. One is at the Ashland County Sheriff in the annex, and the other one's down in Loudonville in the police department's lobby. But basically, whenever those lobbies are open, folks can get rid of those excess medications that might be lying around, because again, we talk about risks and prevention. The more of these extra or unused medications we can get disposed of properly and out of the hands of who knows who, the better.
Yeah, I just did a talk last week with a group of people down in Loudonville, and I think a lot of people don't know those exist, so I'm glad you brought that up.
Yeah.
And it's easy to do. You can go in, just drop it off. It's not like...
No questions asked.
You're right, yeah, and I think that's a great thing we have here in Ashland County. So.
Yep. Another thing, speaking, and again, that's why we do these episodes, and that's why we do all of our community education, is because, as Dr. Asher said, a lot of folks just don't know. They don't know. So we keep doing these things. And I know for the people that do know, they said, "Oh, David, not the boxes again." Well, that message isn't for you. It's for the people that never heard about our boxes.
Right.
But there's another thing that, Rick, I know a lot of people don't know about our quick response team, but this is another way that we're trying to make an impact for individuals that maybe have just recently overdosed. So if we could just, if you don't mind, take a few minutes to talk about what is the quick response team in Ashland County. What's that all about?
It really is about the deflection of the use of any kind of drug, but more importantly, to help deflect and prevent future overdoses. So, along with our peer recovery support person at ACCADA, Lori McLaughlin, to 4 metric detectives, either through Ashland City Police and or the Ashland County Sheriff's Department. They go out on post-overdose visits.
So after somebody has overdosed, like,
right.
Okay.
Mm-hmm. And so if it obviously if it was called in emergency services and they have that information, they will do an outreach to the individual or individuals, just depending on the situation, and try to also have contact with if they have any support people or family that may have been involved or just was at their residence. We want to talk to everybody in the household. So it's really a non-punitive type of visit, and so, the officers are in plain clothes, they drive in an unmarked car, so it's really to foster a relationship between the community and the legal sector at the same token. But most importantly, during the visits, they're doing Narcan education. We're doing distribution in terms of giving Narcan out, and really talk about all the resources that are available in Ashland, throughout the county and the community. That are available to any individual or family affected by substance use, or if they have mental health concerns, or if they have food disparity, any of those type of things. We're looking at their basic needs all the way through potential treatment needs or recovery needs. So it's really informal yet formal type of visit. And it's voluntary, and most often for the people that they do reach, they're 100% cooperative, engaged.
Yeah, that's amazing.
Want to get involved. I know last year, I think they had over 40 contacts.
Yeah.
And that may have been with the same individual on more than one occasion regarding their own single overdose, but they can do follow-up. So it isn't just one a one-time visit necessarily. It really depends on the individual, what they want, but we'll follow up with them as long as it needs to be.
Yep.
And this year, we've done about 17 visits.
Okay, so far. Yeah. So I guess I want the audience to know that, that's the way Ashland County cares about our folks that are struggling with this issue. So if you have overdosed on an opioid and you're taken to one of our ERs, well, you should expect that whether it's you yourself or a loved one, that the quick response team is going to be coming out within a few days to talk about that experience, because we see that experience as a potential turning point in your recovery. So as Mr. Ford says, with Lori, the peer, as well as our law enforcement folks, they're going to try to engage that person. It's like, this just happened. This near-death experience just happened a few days ago. Let us get involved and help you avoid that in the future. Let's do what we can to reduce any barriers that you may answer, any questions, et cetera. So I just want the audience to know that that's the way this community cares about our folks that are struggling. We often say that the recovery journey, it's a spiral. It's just not a linear line that goes up. We know folks go through these various times. So just know that, as Rick said, we'll go out. The quick response team will respond to the same individual multiple times because we understand that. And that's another thing, Rick, you've brought to my attention. Some folks feel like if they've been receiving treatment at ACCADA or other agencies, and they're doing well, but then they have a relapse. Well, I can't go back there. People will talk about me, or they'll think something. Nope, they're not, because they understand that the recovery journey is not linear. In fact, I think some of the best therapists, Rick, they talk about that at intake. So, if in fact the person does have a slip or a relapse, they don't feel ashamed to go back and get help from that agency. Rick has a tagline for his substance use minutes. Can you recall what that tagline is, Mr. Ford?
Let's support, not judge.
Let's support, not judge.
Love that.
Yeah, Rick introduced that some years ago now, it seems like, and I really appreciate that. I've tried to tell him that, and I support that. It's not about the judgment. It's about getting the person the help and the resources they need. So good job on that, Mr. Ford.
We have examples at our office every day about people returning.
Yeah.
Not necessarily because they had a slip, just because they want to tune up.
Yeah, interesting.
And they kind of know themselves, and they've worked treatment and been a part of recovery, and recognizing maybe some personal signs or indicators that I need to go talk to someone, either it be at ACCADA or somewhere else, but I need to talk and work this through to prevent it. So they're all, getting to a point of doing their own prevention. And I know I just got a call last Friday with a former, he was actively engaged in treatment, called and said, hey, I did slip and I need to come back in. That's fine. Come on in.
Yep.
So I'll see him tomorrow morning.
Well, Dr. Ashley, we are meeting with Vicki Taylor, our health commissioner. Their number is 419-282-4231, as well as Rick Ford, the director at ACCADA, 419-289-7675. And in this next part of the conversation, again, we just want folks to kind of understand what someone might look like, sound like that's overdosing. So Vicki or whoever wants to take this, this is more of the crisis situation. So if you maybe come across somebody that experiences the things we're going to talk about, they may be experiencing an overdose. Some of these symptoms or signs are pretty telltale, so we don't want folks to be alarmed. And as Rick said, a lot of this is in the actual naloxbox, if those are available. But if you could, maybe Vicki, if you could take this, just talk, what would folks maybe see here if they come across somebody that is in the process of overdosing on an opioid?
Sure. Well, they would have symptoms of a limp body, slow to stop breathing. They might be vomiting or making gurgling noises. They may look pale and feel clammy.
Okay.
And their lips may turn purple or blue color. You're unable to wake them, unable to speak to them, or they're unable to speak to you. What
do we do?
Yeah, so
if I come across that scene, that's a little scary.
Absolutely. And, those are similar symptoms to something else, too. So you may not know for sure, but my first response would be to give the Narcan. Yeah. Like we said earlier.
If that's available.
Yes, give it because it's not going to hurt them. If it's somebody having a heart attack, it's not going to hurt them. Okay. And then call 911 right away. Yeah. And if you're there by yourself and it's hard to give both, do the Narcan and then call 911 right away. If someone else is there, you can maybe be administering the Narcan and yell for someone else to call 911.
Yeah. Yep.
But I think to get the quick response rolling is real important. It also could be that one dose of Narcan may not work.
Sure.
So if you have multiple doses, you might want to try again until someone arrives that can give other medical treatment to them.
Right. That's very important. So, again, we talk about those symptoms. I know some of those might be hard to hear, but we wanted our audience to know a little bit of what it looks like and sounds like, perhaps, so they're not too alarmed. But it is somewhat alarming anytime you come across this situation, to be honest.
No matter what's happening to somebody, it can be alarming.
Sure.
And I think the more that we're aware of it and the more that we can think first about what we would do rather than standing ourselves in panic mode and just administering the Narcan and call 911. And so those would probably be, if you could just get those two things in your mind, I think that would help to save a life. And that's really what we want to do. We want to save that person and try to get them into some kind of treatment program. So.
Yeah, agreed. Well, we've been speaking with Vicki Taylor and Rick Ford about this important issue of overdose awareness. And again, I will drop their contact information into the episode description. But if folks want to learn more about any of these issues, the Narcan, the naloxbox, the education prevention that's going on, any of these things, a quick response team, I think the best thing is just to contact each one of you to talk this through.
Sure.
Does that sound good?
Absolutely.
Right.
All right. Well, Dr. Ashley, this was an intense episode for me.
Yeah, very informative.
Yeah, but I'll tell you, it's a serious issue because, as Vicki said, we're losing too many folks when we sit down for those yearly reviews. It just breaks my heart, whether we're talking about suicide or overdose, every time we're losing somebody. And we're trying to learn from that and respond with all the different things we've talked about today to hopefully get that number to zero.
Absolutely. Yeah. I just want to say thank you to both of you for the good and important work that you do.
Yep.
And you as well, because I think raising an awareness is, a good step. And I think you said it earlier, it should be more than an overdose awareness day.
That's right. Yeah.
Or even a month. We should be making the awareness every day.
Yep.
And we need to be talking to people about this. We need to reduce the stigma. We need to kind of talk about things like self-care and how we can help people manage stress and all of these things that could be leading up to somebody making the choice to use.
That's right. That's great.
And get engaged in each other's lives. We are a community, and we need to know what's going on with each other in our community, and that's the best way to kind of reduce this is to be involved in each other's lives.
Well, I cannot add to that. That was very well said, Health Commissioner.
Thank you.
Well, thank you, everyone, and until next time, thank you for listening to another episode of the Keeping Ashland Healthy podcast. The podcast is a production of the Mental Health and Recovery Board of Ashland County, Ohio. You can reach the board by calling 419-281-3139. Please remember that the board funds a local 24/7 crisis line through Appleseed Community Mental Health Center and can be reached by calling 419-289-6111. That's 419-289-6111. Until next time, please join us in Keeping Ashland Healthy.